Anxiety refers to a state of anxiousness, as its name implies, but I guess other terms that might be appropriate would be excessive worry. For example, somebody with Parkinson's who the family wants to take out to dinner, and they can come up with a million excuses. I don't want to go, maybe the car won't start, maybe the restaurant's full, maybe my medicines aren't going to work, etc. Some of it may be more of a sense of foreboding. Some people just have kind of this uneasy feeling. Depression would refer to more of a depressed mood, and sometimes that can manifest itself in terms of sadness, hopelessness that a person might express, and sometimes it might be more subtle. In terms of Parkinson's disease, these are very, very common symptoms. And in Parkinson's, typically, when you talk about Parkinson's disease, most people will associate it with things like tremor, stiffness, slowness, and those are what we term motor symptoms. They involve the muscles and the motor pathways. But we know that there's a lot of symptoms in Parkinson's that are non-motor, and that would include things like constipation, dizziness, sometimes memory problems, and so forth. And depression and anxiety tend to fall into that category. For some people, maybe the depression isn't an overt feeling of sadness, but the family has noticed they just seem more withdrawn. They're not interested in things that they used to be interested in. Sleep is lousy, appetite is poor. So these are some of the things we need to pick up on as far as recognizing. And then as far as treating, there are non-medication approaches to treating some of these symptoms, and there are medication approaches. As far as the non-medication approaches, just like anybody who has anxiety or depression, some people may benefit from psychotherapy, talking to a psychologist, understanding what's going on, and they can often teach them some tools to effectively deal with some of these symptoms. Biofeedback, relaxation techniques, and so forth can be very valuable. But in some situations, the non-medication approaches may not be adequate. And so for a lot of people, we are looking at medications. For those individuals, there are medications such as Alprazolam, which is commonly known as Xanax, a relatively short-acting benzodiazepine. It's in the Valium family. And those are medications that can be helpful to sort of work quickly, not stay in the system a long period of time to kind of calm the mood. But I think it's interesting to note that some of the Parkinson's medications themselves may actually have some antidepressant effects. And pramipexole, which is one of the dopamine agonists, has also been demonstrated to have some antidepressant effects. Very often what we'll want to do is we'll want to choose a medication based on its side effect profile, so that if we're going to treat depression and anxiety, let's also treat some of the more important symptoms. For example, if somebody is having trouble with sleep, if they're having trouble with appetite, there are certain medications that might be more prone to produce sleep at night, stimulate the appetite, and so forth. Other medications might be more stimulating for somebody who's having a lot of lethargy, for example. So very often we may want to check or choose a medication based on some of these side effect profiles. With Parkinson's disease, some of the classic features are loss of facial expression, soft speech, less movement, and those are exactly some of the physical manifestations that we might see with depression. And very often, people will assume, looking at somebody, that they're depressed. And I've actually had some people who've been referred with Parkinson's who actually first started off in the psychiatrist's office because their doctor looked at them and said, "Oh my gosh, you look depressed," and then realized that they weren't and that it was actually more a manifestation of Parkinson's disease. So I think it's important to realize that there is sort of this overlap in terms of presentation. And because someone with Parkinson's maybe does have less expression, etc., don't assume that they are necessarily feeling sad or what have you. And I guess the flip side of that is some individuals with Parkinson's may develop a condition called dyskinesia, which are involuntary movements, kind of wiggling sort of movements. And again, it's a side effect of the medication. Well, somebody who has a lot of these movements sometimes may be perceived as being anxious or agitated. So that's sort of the flip side of that presentation. So it is important. I think as physicians, hopefully we're pretty good in terms of realizing that what we're seeing physically doesn't always translate into a specific mood. But I think, yes, to the casual observer or even to a caregiver, sometimes it can be tough to sort through that. I think the first step is making it very, very clear. Look, this is a part of your condition. Just as much as your tremor is part of it, these mood changes are a symptom of your condition. And I think if people can kind of understand it on that level, it's not quite as threatening, and they're much more open, to hear, about what's going on. And then explaining how common it is, that they're certainly not alone. As you said, maybe 60%. I wouldn't be surprised if those numbers are higher, just depending on how closely you ask and so forth. And letting people know, hey, this is very, very common. You are not alone. Getting people to understand the implications in terms of how it affects their life, and just kind of pointing out for them how those types of symptoms can sort of take over and rule their life, and how we definitely don't want that to happen. And then being very positive and encouraging in terms of treatment approaches. Going with the non-pharmacological issues, as we talked about, exercise, get out there, be yourself, do what you want, do what you enjoy, but not being shy about utilizing medication when it is appropriate, and how big of a difference it can really make in somebody's quality of life.